Wendy Jones, and you're listening to The Patriot FM 101.5 AM 1400. Welcome back to our Next Steps for Seniors program. Each and every week we do our best, really, to bring you pertinent information that will help you in your journey, this journey called life. And, I guess my motto really is to embrace this time. I was talking to someone the other day that isn't able to drive anymore, and he was a little discouraged, and he really wanted to have that independence and be able to drive. And I was telling him, I said, you know what? I said, I hate driving. Driving is really difficult, especially nowadays. There's a lot of distractions. People are on their phone. They're not paying attention. They're not looking at people walking and riding their bikes anymore. Driving's become something different. Wouldn't it be kind of cool, and I was telling him, just to sit in the back seat and be able to enjoy a drive and not have to concentrate on where you're going to turn, how you're going to do it. You're basically getting chauffeured around at this point in your life. And he looked at me and he was like, I never really thought about it like being chauffeured. I'm like, yeah. I'm like, who cares about being behind the wheel, man? Get chauffeured. So I just want to encourage our listeners. We have a choice. We can look at life, like the glass is half empty or the glass is half full. And we need to embrace these times, and that's why New Life Medical is here with us today, because this is an alternative that we could look at prior to any surgical treatment. So why not try it? That's why you're here, because we really want people to know that there is an option that you could, and it's covered by insurance. It's such a no-brainer. So talk to us about some success stories. You keep talking about your patients and people that have come in. So give us some of those stories just to share with our listeners.
Yes, of course. I actually will give you a personal story. My grandmother, actually, she received a total knee replacement on her right knee. And after surgery, evidence-based practice has shown that 40% of those who are in the elderly population, after any type of anesthesia, can have delirium for up to 6 months.
Wow.
Yeah.
Okay, that is a big deal.
In the elderly population, so those over the age of 60.
Okay.
Yes. So unfortunately, my grandmother was one of those that had the delirium, and I went to go visit her at the hospital, and after her surgery, and she kept calling me my mother's name. And it was very sweet, but I kept reminding her, Grandma, it's me, Rakel, and she just could not snap out of it, and she was like, no, who's Rakel? I don't know who Rakel is. You are my daughter, and she just kept calling me my mother's name. So it was very heartbreaking, and it took a couple weeks for her to finally get out of that delirium, unfortunately. But that really broke my heart. And then on top of it, she had 3 months of rehab. She had to go to a rehab facility and stay there. Extensive rehab at a.
And she was in her, how old did you say she was?
My grandma at the time, she was 69.
Okay.
Yes. And now she is 72. So yes. And so she had the surgery at that age, and she went to extensive rehab, and unfortunately she only had about a 40% improvement after the surgery. So she definitely
3 months of her life, literally, and it was 40%.
And pain medication that she had to take after. Her mobility changed, her gait was altered. She had to use a walker for all those 3 months. She could not walk by herself. She needed help with transfers, help using the restroom because she was scared she was going to fall after surgery. It was just heartbreaking. It was extremely heartbreaking. Mind you, the delirium didn't help, especially at nighttime.
And that lasted how long? Just a few weeks?
Yeah.
Or you said it could last up to 6 months?
It could last up to 6 months, and it could be, essentially it could be permanent as well. With any type of anesthesia in the elderly population, it could cause 40% of individuals will experience delirium after anesthesia, which is a huge percentage.
Well, that alone could almost keep people from having surgery.
Exactly.
I'm not going to lie.
Exactly. So it was very hard on my grandmother. It was very hard on our family because we constantly had to be there for her because she just couldn't do it alone. She just could not. We had caregivers taking care of her as well, and so she told me that she would not get another knee replacement on her left knee. She was like, absolutely not. I will not. I want to do something else. I want to feel better without having to go through all that 3 months of pain and 3 months of rehab and not get the outcome that I really wanted. So I offered her these injections, and she was able to have the relief that she never had before. She said that after the 5-6 weeks that she was at our clinic, she had a 60% improvement, which was more than the knee replacement that she only got 30 or 40%. So it was pretty significant, and it actually lasted her longer than a year. So that's excellent.
So how long after the first surgery did she start with you guys to do the?
She came back after she did.
Like
it was a year. It was a year. Yeah.
And it was with the other knee then?
Yeah, it was the other knee because we couldn't do any treatment for the total knee replacement, unfortunately. Yeah.
That is the perfect story because it helps us understand why not try it.
Yeah, exactly. And now Grandma goes around and tells everybody about her granddaughter.
I'm sure she does.
And it's the sweetest thing ever. I'm like, Grandma, stop.
How many people in your office do these injections? Is it just you or do you have a couple?
So there's 3 of us. It's myself and then Candace Guma, who's another nurse practitioner, and then Dr. Steve Calabat.
So 1 physician
yes.
and 2 NPs.
Nurse practitioners, yes.
Okay.
Yes.
All right, excellent.
Mm-hmm.
And now, are there other places that do what you do?
Yes, there are. Most orthopedics will do these injections as well, but they don't offer it because they want they want surgery, right? They're surgeons.
That's where the money
Surgeons
is.
want to do surgery, right? It's just it's a no-brainer, right? So a lot of clinics will offer it, but they won't offer it unless patients will say, surgery is not an option for me. It's an absolute no. And most of my patients will even come to me and say, I cannot do surgery for comorbidities that I have, high blood pressure, I have sleep apnea, COPD, heart problems. I have diabetes and I can't go under. I have a high risk of infection. So there's a lot of things that correlate with the non-surgical approach. So these clinics will offer it, but it'll be their last option that they offer. With us, it's our first option, right? And then surgery is always the last option, which it should be. I think it should be that way. But each physician has their own approach, and each provider will give you their recommendations. But what sets our clinic apart is the guided imagery. So we always use guided imagery.
And not everybody does.
No, most clinics do not. And the reason why is because you could find the spot by just feeling for it. But we want to ensure every knee is different. Your knee, Wendy, is completely different than my knee. I don't know I know general anatomy of the knee, but I don't know the anatomy of your knee without taking the image to make sure that I do know it. So we do this on every single visit. We take an image of the knee to make sure that we are in the right spot. And we inject a dye to make sure that the dye will spread in the correct spot. And from there, we inject the hyaluronic acid. We're not wasting product. Patients can see it live. They're satisfied. I can see it. I know 100% I'm in the right spot. It's just a all-around great thing to do.
Does it cost more? Why wouldn't they use guided
It's just
imagery?
it's more time.
Time-consuming.
It's time-consuming, and we're willing to take the extra time to do it.
Thank you.
Mm-hmm.
I mean, really, thank you, because
Yes.
why wouldn't we want to have guided imagery if we're going to do any kind of biopsy or injection?
And the time difference is a matter of 5 minutes. It really is. I'm not even exaggerating. The whole procedure itself, the whole injection itself,
yeah, from beginning to end.
to end, takes 5 minutes. So if you were to not use the guided imagery, it would take about 3 minutes. So it's a 2-minute difference.
Why would we not do this?
Yes, exactly.
Oh my gosh. Okay, so let's talk about any other pain relief options at New Life Medical.
So we also have platelet-rich plasma, which is we take your blood. We take about 10 milliliters of your blood, so just a vial of your blood, and we spin it in a centrifuge. And this is your own substance. It's coming straight from you. There's no foreign substance that we're injecting into the body. We spin it and we take the platelet-rich part of it. The platelet-rich plasma has growth factors in it. So all the damaged muscles, ligaments, and tendons within the joint, the platelet-rich plasma will help heal it. Yeah, so this is my favorite injection. And you could ask everyone in the clinic and they'll tell you Rakel loves platelet-rich plasma. And the reason why is because I get to have that bedside manner with my patients, and I get to draw their blood, and it takes me back to like when I was studying in school, and I get to sit there and draw their blood and talk to them, and it's so fun. It's just so fun. And then I get to show them after I spin the blood what it looks like, and it's it's me getting all nerdy and back to school.
I thought
and
it was. I thought you were going to say biology and chemistry.
Exactly.
And all those classes
That's
too.
exactly what it is, and I just get so excited, and it's just such an amazing thing to do that you can take from our own bodies can help heal yourself.
It is amazing.
The growth factors within our bodies, within our blood, can help heal what's damaged in our own bodies. So this is one of my favorite injections to do, and platelet-rich plasma treats. We treat the shoulders and the knees and the elbows with platelet-rich plasma.
Shoulder, knees, and elbows.
Yes.
Okay, and is that all covered under insurance?
Unfortunately, it is not.
Oh, why did I know that was coming?
Yes, because it is considered cosmetic.
Right.
And
it's very cutting edge.
Yes.
I mean, how long have you been doing platelet? I can't even say it.
How long has platelet?
Yeah. Go ahead. See, now
PRP has been out for many years. Many athletes have used it for 15 years now. Tiger Woods is a great example.
It's going to be covered. Okay, we'll be back right after this commercial.